I'm extremely honored to introduce our first speaker this afternoon. Alison Barkoff is performing the duties of Assistant Secretary for Aging at the Administration for Community Living. A sibling of an adult brother with developmental disabilities and an avid civil rights attorney, Alison is a lifelong advocate for community living. She has fought to uphold the rights of people with disabilities and older adults, and to advance policies to ensure their access to health care, housing, employment, education, and so much more. During her leadership at the Administration for Community Living, she has worked with partners across the federal government in an unprecedented, historic manner to really transform so many programs and update regulations that touch all facets of community living. From expanding access to home and community-based services, to strengthening the direct care workforce, and advancing equity, just to name a few. I don't know how she's standing. She has been so busy these last several years and in the recent weeks and days, making sure she makes the most of this platform and opportunity, setting the stage so all can age well in America. We are so appreciative of your leadership, Alison, and so extremely pleased and honored to have you here with us today. Welcome to the stage. Thank you for your leadership.
Thank you, and good afternoon. Happy Older Americans Month. I'm so excited to be here with you today, and I am so happy to see a packed room at a conference focused on not only aging well, but the back half of the conference, action. And I hope that what you hear from me today, as we talk about our shared goals and priorities, is how we are taking the things that are important to you and that are important to the aging community and turning it into action. I want to thank Ramsey and NCOA because you all have been such an incredible partner on so many things. I could go on and on and on, from vaccinations, falls prevention, the work together on direct care workforce, nutrition programs, community care hubs, senior centers. I love doing the exercise at the senior centers. We need to go back. Kathy, come with us. We can do a video together instead of just Bob Blancato and the two of us. Housing and reaching underserved communities. Truly, NCOA and all of the members, thank you. We could not do what we're doing without your partnership. I'm really excited that in addition to hearing from me, you'll be hearing from ACL's new Deputy Assistant Secretary for Aging, Kari Benson. When we were here last year, we were honoring Edwin and his incredible legacy, and we weren't yet in a place to tell you who would be coming in behind him. But what I can share is you have an incredible partner and an incredible advocate in Kari Benson. Kari has spent her entire career at all levels of the Aging Services Network. She is focused on advancing equity in every single thing that she does, making sure that our programs are inclusive and meaningful and reach everyone. She has so much expertise, from Older Americans Act programs to adult protective services to Medicaid to working with the tribes. And I know that you will find she is the perfect person to build on Edwin's legacy. So we're now at the point in the administration where we're really reflecting, at least I am, on what we came here to do. What I heard from you all. On the first day I got here, I was a day one appointee, and what was most important to me, what is so important about ACL, is we cannot advocate for a community if we aren't hearing from you. And so everything that we have done, everything that we have achieved, is because you have said, this is what we need you to push for. This is what older adults need to age well, to be included in their communities, to be healthy. And action truly is where we've been. I do have to say, Ramsey, I do feel like I could take about a 6-month nap on the floor after the things that I'm about to share with you, because we have been looking at this open window and running and pushing. So let me start with one where you all have been an incredible partner, but it has come from the top, which is around strengthening the care infrastructure and making sure that we are supporting our paid and unpaid workforce that makes community living possible for older adults. Truly, it is because of you that we are in a situation that 2 years in a row, our president in the State of the Union talked about our issues, about aging in place, about supporting family caregivers, about supporting the direct care workforce, about increasing access to community services. And that doesn't just happen. It happens because of your advocacy. A year ago, we had the first ever care executive order, and that has been incredible wind behind our back. Combine that with incredible investments as part of the American Rescue Plan, again, because of your voices. Over $1 billion in Older Americans Act funding and $37 billion in home and community-based services. From the moment that I arrived at ACO, I knew we had to take action. And we have heard from so many people about the importance of supporting the workforce, including the Aging Services Network that provides community-based services. We have such an incredibly challenging turnover rate, 50% turnover, 75% of providers declining referrals, half closing services, all because of staffing issues. And we knew we had to do something big and bold. And I really want to thank NCOA for their partnership. We created, working across federal government, the Direct Care Workforce Strategy Center to be a centerpiece to work with states, bringing together Medicaid and aging and disability and labor and workforce on this critical issue. And we are so excited that just in the last couple weeks, we've had announcement after announcement after announcement, including 20 states where we will be working to provide technical assistance, an advisory committee made up of the voices that matter the most, people receiving services and direct care workers, and an incredible website that is a hub of resources for all of us. We know, though, because of the workforce crisis, that the 53 million caregivers in this country, family caregivers, has had to take on more and more. And it has been such a privilege to lead the development of the first ever national strategy to support family caregivers. This is visionary. It is both the North Star of where we need to go, but it's concrete, with over 300 commitments from federal agencies and the actions that each of you need to take, providers, advocates, family members, state and local government, and businesses. And we are so excited that we were able to launch recently the National Caregiver Support Collaborative. And keep your eyes open, because we are holding ourselves accountable, and soon we'll be putting out a report on what we have done as a federal government on our own commitments. We are also focused on expanding access to community services. And Kari will talk in a moment about a big thing that we did here, which is putting out for the first time in over 30 years, the first comprehensive update to the Older Americans Act. We really tried to leverage the lessons learned from the pandemic. We're trying to focus on equity and making sure that all means all. And we are highlighting the flexibilities that are needed to make sure that we can focus on meeting local needs. We've also been working with our partners at the Centers for Medicare and Medicaid Services. And that's another place where just in the last 2 weeks, we have pushed out 3 huge, humongous regulations. And I hope people noticed that The Medicaid access rule is groundbreaking. It is about the very things that make home and community-based services what they are: person-centered, expanding access, strengthening the wages for direct care workers, making sure people are healthy and safe with strong incident management. And that rule really complements the work that we have been doing in ACL around health and safety and welfare. People must be healthy and safe no matter where they are. And we took a bold step. We are not an agency that does a lot of regs, and it would have been enough with just the Older Americans Act, but no. We decided that this was the moment in time, really standing on the shoulders of people like Kathy Greenlee, who started the incredible work around elder justice with our visibility around adult protective services, the first ever federal funding. We felt like this was the time to create a federal home. And so soon, very, very, very soon, you will be seeing the first ever adult protective services regulations. And you'll see in there how we think about working together with other agencies, complementing the Medicaid access rule in the adult protective services rule. And people must be safe no matter where they are. And that's why this administration leaned in hard in creating staffing rules for nursing homes to make sure that people can live with dignity and get the support that they need. Underlying all of our work is around equity, and part of that is civil rights. And so I want to just touch on a few big things that we did in the last 10 days that are big steps in tackling ageism and ableism that infect this country. The work that we do about equity really needs to include older adults and people with disabilities, coming in with an intersectional lens, recognizing the additional barriers that an older adult or disabled person face. They're also LGBTQ or from a community of color, live in a rural area, or don't speak English as a first language. Last week, I was so proud to stand beside Secretary Becerra and HHS's Office of Civil Rights to unveil updated regulations on Section 504 of the Rehabilitation Act, which bars disability discrimination, including the 75% of older adults who also meet the definition of person with a disability under these laws. This was our first update in almost 50 years, and it truly takes on the pervasive discrimination that so many people with disabilities, including older people with disabilities, face. Things like discrimination in medical treatment, what we saw when older adults were told, get to the back of the line during COVID, and they needed a ventilator. It requires doctors' offices, exam tables, websites, apps, and kiosks to be accessible, and it clarifies the legal requirements for people to receive services in their own homes and communities instead of in institutions like nursing homes. As if that wasn't enough, we also issued last week regulations implementing the non-discrimination provisions in the Affordable Care Act, known as Section 1557. They prohibit discrimination in health programs on the basis of age and disability, as well as race, ethnicity, gender, sexual orientation, and gender identity. So we now have incredible tools to take on ageism and ableism. Social determinants of health. I will just briefly touch on it because it is so much of the important work that NCOA does. You know, we are doing a lot of work, and you will hear from the White House in a moment, around increasing access and lowering costs to health care through the Inflation Reduction Act. But we know access to health care alone is not enough. ACL is the social determinants of health agency. We truly connect our community-based organizations to healthcare systems. We know that Accessible, affordable housing is critical to being healthy. Food is medicine, and our networks and the senior nutrition program are critical. And the work that we've done around the Housing and Services Resource Center, together with NCOA, bringing together the aging and disability and housing and homelessness networks is really critical. And then our community care hub work, bringing together our networks to work with plans in really incredible ways. So, as you can see, we have been busy. We've been taking your priorities and not just talking about them, but turning them into real action with regulations and monumental initiatives. And truly, we could not do this without your voice, without you as the wind behind our back, and without you constantly pushing and advocating. So I would like to now turn it to Kari Benson so she can share some additional aspects of the work that we are doing. Kari?
Thank you, Alison, and thank you, everybody, for having us here with you today. And it is such an absolute pleasure of mine to be here with you all. I want to thank Alison for her leadership, and it really has been incredible last 3 months. And I think not just because it's been the first 3 months of me being in this position, and that's been pretty incredible for me, but I feel like I have had to just kind of jump on a bus or a train that was barreling full steam down the track and hang on for dear life to keep up with Alison and the whole ACL team, and it's just been incredibly exciting and such a pleasure to be a part of a team that is really putting the words into action, as Alison said. I'm going to take a little bit of time here and talk a little bit more about the Older Americans Act regulations. And, you know, I have to say there's a lot there, over 400 pages. I will encourage you all, read the preamble to the regulations. That really tells you a lot about what we are hoping to achieve through the regulations and what we want to share with you that goes beyond what we can put in the actual regulations, but is more about the spirit of the regulations and really the spirit of the Older Americans Act itself. I want to highlight that, you know, for us in the Aging Network, and I've worked, as Alison said, my whole career in the Aging Services Network at all the levels, and to have these regulations in place really provide us a path forward. And I would say in particular in two very key areas. One, in terms of advancing equity, and the second, in terms of advancing innovation. So I just want to spend a little bit of time on both of these areas, but again, look forward to working with you all and supporting you all in implementing the regulations. First, in terms of supporting equity, the rule outlines in many sections what we need to do at all levels of the National Aging Network to make sure that we are meeting the needs of individuals with the greatest social need or the greatest economic need, or both. And we spell out in the regulations the individuals who meet these definitions. We spell out requirements that we need to fulfill at each level of the Aging Services Network. I want to point out in particular, there is a section that goes into the coordination of Title III of the Older Americans Act and Title VI, which is the funding received by the tribal organizations around the country. And that is a really critical part of both expanding access to services for Native elders and their family caregivers, and really about coordinating services to them, both in terms of in situations of particular need during disasters, emergency situations, but also on a day-to-day basis. So that's a key aspect of the regulations for us. In terms of serving individuals with greatest social need and greatest economic need, we spell out in the regulations the need to make sure individuals who identify as one of those criteria, that they are really a part of all of our processes, our planning process at the area agency level, at the state level. We are taking into account their needs when we are prioritizing and really putting into place strategies to partner with organizations who serve communities who may not have received services in the past, who may not have full access to services, really about those partnerships at the community level. It's about outreach to communities. It's about really coming together across the sectors to best meet the needs of individuals who need those services the most. And I would say in a very complementary way, the regulations also provide us a very clear path forward in terms of supporting innovation. The regulations provide us with what I like to refer to as minimum guardrails that is needed at the state and regional level to allow us all to bring in additional revenue streams to really bring to bear in scaling up innovations that you all are very much a part of, both demonstrating and implementing, and then, like I said, disseminating and bringing to scale. So we want to make sure that we highlight to all of you that there is a lot of information and guidance in the regulations to support these innovative efforts around the country. And again, be sure to read that preamble of the regulations, and that will get you started on that light reading that we're all doing across the network. And I hope you all do make sure you check our website. We will be updating that with additional resources. We have our monthly Back to Basics webinar series, which will take you through the various sections of the Older Americans Act regulations. And I have been so pleased to be able to jump into this with the team across ACL, supporting your efforts, and we're working very hard in order to do that. Now, I want to shift gears and spend a few moments talking about an effort that ACL has been proud to lead, which is the Interagency Coordinating Council on Healthy Aging and Age-Friendly Communities. Now, that is quite a mouthful, but basically stands for our effort at the federal level to develop our national plan on aging. And again, as Alison said, very similar to the efforts you've already heard about, this will not be possible, and this will not become a true national plan on aging without all of your input. So we are just at the beginning phases of this effort, where we are drafting a framework that we are going to be issuing hopefully this month for Older Americans Month, and we hope to get a lot of your feedback on this framework. We hope to get input by older Americans across the country, by community members, by state-level advocates, and all of us in shaping this national plan on aging. The framework so far outlines federal agencies' efforts to be a part of this national plan on aging, and it outlines for all of you and for your consideration domains of action. You'll see these very much mirror your efforts at the state and local levels, and we use that to inform this framework. So again, be on the lookout for that. We just had a phenomenal listening session, the first one that we will be doing as a part of this effort, just last Friday at the Deanwood Community Center in DC, and we will be having more, and you will be hearing about that from us as well. Now, I would be remiss to be up here talking about all of the great work that we are a part of at ACL without highlighting a little bit more our work around healthy aging. I do want to highlight in particular the work that we are proud to be a part of to address social isolation and the epidemic that it represents in our country. In particular, because we know that social isolation is one of the primary risk factors for self-harm for individuals of any age, and we know that suicide rates of older adults is the highest of any age group. We are taking that very seriously with our other federal partners, and with all of you. And we are proud to be a part of a virtual summit on social isolation that is coming up just next week, May 14th and 15th. And we encourage you to visit our committoconnect.org website for information about how you can be a part of the national efforts to address social isolation and support older adults in your communities and really address the social isolation in our communities. It also is our theme for Older Americans Month, Powered by Connection, and that is very intentional and really raises up the priority that we are placing on all of us being more connected with each other, being more connected to our communities at all ages. And so we're very much looking forward to the rest of our efforts within Older Americans Month. We know you all are a big part of that as well, and we want to thank you for that. And I want to add my personal thanks and gratitude to all of you for all of the phenomenal work that you do every day to support older Americans. Thank you.